going to move on to insurance reform. Health insurance, and I didn't know this until I started really delving into this issue, it wasn't tied to employment until World War II. World War II, there are only so many able-bodied men that weren't off in war that could be employed. And so there were salary caps that were put out there that what these workers could be paid. So an additional way to attract workers to your employment was to offer them insurance. It's not sold at a true free market like auto insurance, and is heavily regulated by the states and burdened by legislative mandates. These are expensive options that must be included in a policy, and they're not truly necessary. True insurance covers the cost of catastrophic loss, such as your house burning down, such as totaling your car. It's not what we have right now, which is prepaid health care, where everything in the world is supposedly paid for, except if you look at the taxes on the back end. True insurance is portable, so where you go, it goes. Again, that will limit pre-existing conditions a lot. So insurance reform, we've heard this a few times before. We need to eliminate the interstate restrictions on the sale of health insurance. We need to eliminate the dependence of insurance on employment. If you want to get your insurance through employment, fine. If you want to get your insurance not through employment, you should have the same opportunity to do so. We need to give the same tax breaks to individuals as we do to employers. We need to allow small businesses and individuals to pool resources. We need to further foster high-risk pools for pre-existing illness and encourage HSAs. So briefly, HSAs, they incentivize consumers to control costs. So I can get an MRI down the street for $400 less than I will, right down the hall. I'm going to go down the street and save money. That's going to help control costs. Stimulates market control and the cost, and it stimulates competition. And there have actually been some studies. The Mackinac study for public policy showed that $200 billion, again, per year would be saved with HSAs. Just think about it. If we have HSAs and we have true liability reform, just think about what that alone could do to healthcare costs. And what the money that is not used in your HSA, it stays with you and it grows with you. This would empower the individual. Our last portion that we'll cover is personal responsibility. The United States really does a good job at a lot of wonderful things and also some not so wonderful things, such as having the leading rates in obesity, tobacco-related diseases, and preventable injury. Determinants of individual health and early death. 40% are due to lifestyle and behavior. So if we get ourselves healthy, that's going to help decrease healthcare costs. If you compare the rates of obesity in the United States and Canada and the UK and Canada, 20%. The United States, 30%. We could fix that. We could take a chunk out of diabetes. Number 2 cause of early death, genetic makeup. Okay, that we can't change. Number 3, social and environmental factors. And the 4th cause of early death, only 10%, lack of access to medical care. Lack of access to medical care is not what we need to focus on. We need to focus on personal responsibility, insurance reform, liability reform. So the promises of PPACA. Barack Obama had said that the average family premium would decrease $2,500. And the reality is CBO estimates that our premiums will increase by $2,100. It's a spread, that's a delta of almost $5,000. That's a big error. We've been told that it's going to cost $938 billion. Reality, depending on the day, it's 1.7, sometimes $2.5 trillion. It's at least double what we were told that it was originally going to cost. We were told in March of 2010 it was going to decrease the debt, $138 billion. But Mr. Blayhouse, the Medicare trustee, he begs to differ. In April 2012, states it's going to increase by $340 to $530 billion. So I'll propose that we need to get ourselves out there and meet new people, not necessarily like-minded individuals, but meet new people and try to educate our friends about what we see in the law. We need to get conservatives into office. And once they're into office, hold their feet to the fire. Keep them out of the Washington machine that tends to corrupt. We need to repeal and replace PPACA with a law that actually does cut costs and help our uninsured patients. Thank you all very much for your attention.